what you do at Macmillan Medical Training College. Yes, karibu. I'm going to start with Mr. Beldens.
Sorry, Madam Daisy, I lost you a bit. I think it was a network problem. Come up again, please.
Yes, was good. I was asking you to introduce yourself because now we are at the introduction part. Tell us who you are and what you do at Macmillan Medical Training College.
My name is Beldens. I'm the academic registrar at Macmillan Medical Training College. My work is majorly to handle matters academics and also to guide students in matters career and sometimes also extracurricular activities. Thank you.
Okay, thank you, Beldens, for that. Over to you, Caleb. Introduce yourself and what you do in Macmillan.
Good evening, all of you. My name is Caleb. I'm a tutor at Macmillan Medical Training College on Nairobi campus. Thank you.
Okay, thank you so much, Caleb. Over to you, Jones. Introduce yourself and what you do at Macmillan Medical Training College.
Good evening, everyone. My name is Nyamari Jones. I'm a trainer. I train perioperative theater technology. I'm a facilitator, I'm a trainer, and also an assessor. Thank you.
Okay, asante sana Jones for that introduction. And now we're going to begin the meeting. Let's try and tell our friends to join in so that we get quorum because this meeting is important to our audience as well. So let us share as much as we can so that we get at least people to join in. We are going to begin right away. So we are going to be talking about the top 5 mistakes that students make, that is healthcare students. So karibuni sana to the discussion. This is a topic on 5 mistakes students make in healthcare courses and how to avoid them. So you're all welcome to give us your nuggets of wisdom, to give us the tips that these students need to use to ace it at their healthcare careers. So over to you. We are starting with Mr. Caleb. The first question, talking about the resources that are available. Tell us the tips that we need to use in this. What is the first mistake that students make in healthcare courses? Karibu, Mr. Caleb.
Thank you so much. I hope you can all hear me. And so the first mistake that students always make is not able to use all the available resources, especially during their learning process. And yeah, so these resources actually may include e-libraries, that is accessing materials online, that is e-library. Then we have online journals. Then we have simulation apps, that is apps that help students to do to carry out their practicals through apps. Then we have keeping their records digitally. That is, for example, their notes, their course outline. Yeah, so such and e-learning platforms actually to access materials online and learning online, that is remotely. Yeah, back to you, Daisy.
Hello, I think I lost you at some point. Can you hear me?
Yes, I can hear
Yes,
you.
yes, yes, yes.
Okay, okay. All right. So I didn't hear you clearly, Caleb, on the first mistake that you mentioned. Kindly, if you can repeat. Asante.
The first mistake that I said is students not being able to use all the available resources that they are given. Yeah, and such resources, I said, they include online journals, e-learning platforms, simulation apps, e-library to access materials or books online. Yeah.
Okay, thank you so much for that, Caleb. Caleb is our digital literacy tutor, and he's telling us that students are not able to use the available resources. They assume that information is only gotten from books, and we forget that we have so much information on the internet. So, for the internet, if you use it correctly, you're able to get as much information as possible because you're able to browse through many sites and get sites where people are able to read books on healthcare and tips on various courses. So thank you, Mr. Caleb, for that question, for that answer. So we're moving on to the next part and the other mistake that students make in healthcare courses. So we're going to be talking about, besides the textbook, what is the other resource you found most helpful in healthcare studies? Tell us, Mr. Caleb, besides the textbook, what's one other resource you found most helpful in healthcare studies?
Apart from that, one of the resources that I found useful is actually I have quite a number of them. I list them, then I'll talk about one. We have something that we call the Google Scholar. Google Scholar is a site actually that is online that provides evidence on what students are learning. If students are learning something maybe related to health, they have talked about something, they can be able to go back and find the evidence of that particular topic that they have learned. So Google Scholar is one of them. We have e-learning platforms. E-learning platforms, students can be able to find resources in portals, maybe uploaded by their teachers or tutors. And also we have online medical journals. Students can be able to do references using the online journals that is related to health. And lastly, we have use of online forums. For example, the forum that we are holding right away, such as webinars. Students can be able to learn from webinars that is on matters related to health. Yeah, thank you.
Thank you. So what I've gotten from you is that we have various resources for learning. It's not only in the textbooks that we have. We have various forums that we can learn from. An example is this webinar that we are holding every Wednesday is the Tutor Spotlight Wednesday. We hold it every Wednesday to be able to give our students tips and to be able to teach them a few tricks here and there on how to study in healthcare and how to ace it as a healthcare student. And so today we are going to be taking out the mistakes that they make in healthcare and trying to correct them by giving them the strategies that they can use to be able to pass the examinations and also to study the healthcare courses. Thank you so much, Dorcas, and someone else has joined. Thank you so much for joining the meeting. Thank you so much, Ailey, for joining the meeting. I would like us to share this information to our colleagues and our friends to be able to join us for the discussion. So we are moving on to the next. Part, still under the same mistake about not using our resources frequently and using our resources well. Tell us, is it true or false that reviewing all the exam papers is a waste of time and not a valid study method? True or false? Reviewing all the exam papers is a waste of time and not a valid study method. Tell us if it's true or if it's false with a valid reason, Mr. Caleb. You still have time, so you can take your time to tell us more about this. Karibu.
So that's false, actually, simply because reviewing old digital exam papers or online questions is not a wastage of time. Rather, it helps. Sorry, I hope you can hear me. So it helps students to prepare well for the exams, to master the setting formats of from their tutors, and also to widen their learning ability, and also improve on digital test taking skills and practice management um, of the exams. So it's false. Yeah.
Thank you for that. We say that all is gold. So going through the past papers enables you to get knowledge of what is being taught in class. Asante sana, Caleb, for taking us through the first session. That was mistake number 1, not using our resources well. So we're moving on to the next part. Would like us to put our comments and our questions on the comment section on the chat box. Let us have your questions brought to board so that we are able to answer them. This is the Tutor Spotlight Wednesday. Karibuni sana. To the next speaker, I'm going to be moving on to Mr. Beldens. Mr. Beldens, tell us about the poor time management. So the first question to you, Saizi. The first question to Mr. Beldens, what do you think is the biggest time management challenge for students? Is it procrastination, or is it overscheduling, or is it all of them? I'll repeat the question. What do you think is the biggest time management challenge for students? Procrastination or overscheduling, or both of them? Karibu, Mr. Beldens, the floor is yours.
Thank you so much, Daisy. I'll be very brief. In most of the cases, most students...
Don't be very brief. You have 10 minutes. Take your time.
I'm brief and precise. So in most of the cases, our students and ourselves, because most of us are also students elsewhere, we take a lot of time postponing, that is procrastination, saying instead of doing assignment A now, let me do it tomorrow after maybe I've watched a game or maybe I've gone to a party and all that. If a student does that at a personal level, then you find that he's going to pile up a lot of activities, a lot of assignment, and piling up a lot of assignments will mean two things. It's either they will not do them all, or they will not do them conclusively. Sometimes you also procrastinate on the time of studies. If you procrastinate on things that are deadline and we're supposed to submit, yes, we'll submit, but we'll submit substandard and therefore poor quality of output in terms of education. But if it is our own, like for example, I'm supposed to study at 7, but I said I will study tomorrow, then at a personal level, it is destructive to my academic growth as a student and as an individual. So procrastination is one of them, is a very major challenge to students. And also rescheduling is a major challenge. And also there's a third one that you've not mentioned, especially for our students who are in our college. Now it's a certain clique of age that is there, majorly between 18 to 25. At this age, they do a lot of social media, TikToks, and sometimes they forget. You'll even go into a class and you expect that you'll find them studying, but in most of the cases, you find them on social media, on TikToks, on matters that are really, really unrelated to academics. So these three factors affect our students in terms of quality management, time management, and also the output of what they're supposed to give in terms of assignment, quizzes, and also personal studies. I can't get you,
Sorry,
Daisy.
you couldn't hear me. Yeah, sorry about that. Thank you for talking about time management burdens and on handling the first case about procrastination and rescheduling. So we have learned that students sometimes tend to reschedule assignments and they choose to spend more time on their phones. But also we were also taught by Mr. Caleb about being digitally literate and trying to look for information on the internet. So if our students can change their behavior, they can still use their phones, but be using them for the right purpose. And at the end, trying to save on time. Thank you, Beldens, for that. We're moving on to the next part. We are going to be talking about discuss with us the practical tips students can use to stay on top of their study schedule. Give us ideas, give us tricks, give us strategies that these students can use as a practical tip the students can use to stay on top of their study schedule.
Yeah, as I approach this, I want to remind you, I don't want to remind you, I want to remember the words of my very, very famous professor, famous to me, not necessarily famous to you, Dr. Benjamin Ombok, who is the principal of Maseno University, Kisumu campus. He once told me this, that you can study. You cannot study the same way every day and fail. And then in the next term, you want to study the same way and expect to pass. What am I saying? As a student, if your strategies of studying are making you fail, if you study the same way this week and you failed a cat, please change your strategies. So this is driving me to two types of strategies that will help our students to be on top of their class. They are categorized into two. Number one, just like a footballer, you have to be disciplined in the pitch and also outside the pitch. Sometimes you might be a very good student in class, but when you are a very bad person outside class, in most of the cases, it affects your studies in class. So there are in-class strategies and there are outside the class strategies. Number one, when you are inside the class, sit properly. I know most students don't do this. Sit properly. A student sitting like they are leaning on the bench, sit upright. There's a posture for studies. Your backbone. I don't know how to call it, but it's aligned to your spinal cord should be straight. If you lean in either way, you are not going to concentrate. Number two, ask questions. Asking questions means learning. Whenever a teacher is in class and you find that you are teaching, even myself, when I talk to you and you don't ask me a question, sometimes I assume that you have not understood and you don't care. You don't care to understand what I have taught. So that is the second problem in class. And then take effective notes, not just any other notes. Take notes that are precise and straight to the points. Number three, also, pay attention. Sometimes you have to, not just your physical presence is important, but your attention is important. I know they say that a human being takes around 10 to 15 minutes to concentrate properly, but that is just a fallacy. Sometimes when it is really, 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 really required, you will even concentrate for 3 hours. If it is a matter of life and death, you'll concentrate for 3 hours. And knowledge is a matter of life and death. So you have to concentrate for more time. Now, outside class, you must also stay organized. I was telling our students on orientation the other day, in as much as you might be a disorganized person out there, Be disorganized, not in Macmillan Medical College uniform. If I find you even inside town, drunk with our uniform, I will hold you by your ear and take you straight to the police by myself. So you must stay organized, you must be disciplined at a personal level so that even the other people they can emulate you, and if somebody was to help you academically, it can become easy. Outside class also, use your study schedule. Be disciplined and stay true to your study schedule. Do your homework properly and ensure that you pass your assignments. There are certain courses where if you get less than 80%, then you are I think CNA is one of them, and most of our medical courses are one of them. Whether you are doing it a sitting cut, whether it is a takeaway cut, you still have to perform properly. So those are the strategies that our students and us can use to be on top of their classes. Thank you.
Thank you. Thank you for that, Brendan. Yeah, so we are moving on to the next point. Aged all, there's nothing to add on to that. So let's move straight to the next part. We are going to be talking about the best strategy for studying for a big exam. Is it cramming for the night, cramming the night before? Is it studying a little bit each day? Is it just reading the textbooks once? Or is it only reviewing the instructor's slides? So this reminds me of a strategy that our students shared with us when we were beginning the student segment sessions. And she mentioned that she usually studies every time, that is earlier before the exams. She prepares and she creates a deadline for herself so that she's able to beat her deadline fast before she beats the school deadline. So tell us the best strategy for studying for a big exam, Mr. Beldens.
Most of the people assume that I just keep quiet, I just watch, and then before 2 weeks to exam, I now start studying, or 1 week to exam, I now start studying. And even our schools spoil us with that, and they tell us, we will give you a free 2 weeks to study. Study, but you are supposed to be studying before. So how do we study for our main exam? Our main exam for our students is the final CNA exam. Now we have CDAC examinations. We have IELTS, we have German exam. So what do? Number one, you start early. The secret is to start early. Do not cram anything, avoid cram. Knowledge is not all about doing exam. Knowledge, Socrates are the first people to start the philosophy of education. Their philosophy was not to pass examination. When they started education, it was not to pass examination. If you go to University of Bologna, in their library, Bologna is in Italy, you'll find that there are writings that were written that education is not all about mastering what is there, but to know how to do what is there. So the first thing is to start early, study in advance the examinations, study in advance the examination day. This does not mean 1 week or 2 weeks. This one, however, means that you should take the moment they start, like for example, today you've started classes in September, those classes should go and should go and should go as you study along, so that it is easy for you when time comes to just go through them. Number two, it is not just about studying. You must also create a plan. Have a work plan. I'm studying at between 7 to 10. I'm studying between 10 to midnight. I'm studying between 4 to 5. So you have a plan. After having a plan, you must also create a space. Organize your workspace. Organize where you are going to study. Is it a corner? Is it a library? Is it in your house? So that you make sure during that time you have no visitor. During that time you are not online. During that time, any other thing. The same way you like to create space for prayer and fasting at a personal level is the same way you need to create space for studying. Again, finally, you should gather resources. Now, it is not all about starting early, creating a plan, organizing your space, gathering resources. Again, it narrows down to how do you do these studies? how are your techniques effective? Like I said before, if you study the same way this week, in a particular way this week and fail, don't expect to study in the same way next week and now you pass. You have to change your techniques. Number one, active learning. What is active learning? Active learning is you to synthesize the notes the teacher gave you by yourself. Understand it from your own point of view, from your own understanding. If it is, for example, a point in bed making or turning a patient, you should understand it in your own perspective. If your perspective is not as the teacher, then now that raises a question, and you should now approach the teacher to ask more. Number two, you should have a spaced review. Review material shortly after learning. Usimalize tu class and then umefunika kitabu. We meet at night when we'll be studying. Take some 10 to 15 minutes to do this. And our teachers always do it very well. They will give you 10 minutes. That 10 minutes does not mean now you leave class early and you go and follow where Supermetro, start lining at Supermetro early so that you use cheaper fare. No, that timing is for you to go and start and review. Sit down right there in class, review. Where you've not understood, ask your friends. Have group discussions for 10 or 15 minutes. That one will work your way. Then finally, the most important thing is use past papers. Use of past papers, because in most of the cases, the questions repeat themselves. Even if the questions don't repeat themselves, but the concepts repeat themselves, the educational philosophies in those questions repeat themselves. And sometimes you'll find yourself studying becoming easy when you are using past papers. So I think those are the techniques that you can use when you are preparing for a major final examination. Yes, Daisy.
Thank you for that. Those are some nuggets of wisdom from you on study hacks for a big exam, like a main examination. You've told us to internalize when we're being taught. You've told us to review afterwards, and definitely to study regularly so that we are able to catch up and have a deadline before the main exam is here. Thank you for that, Beldens. We're going to be moving on to the next speaker. So we're going to be moving on to Mr. Eli. Karibu sana, Mr. Eli, to the discussion. This is the Tutor Spotlight Wednesday. Thank you all for joining. I hope our Facebook audience is able to hear us. Our YouTube audience is also able to hear us. This is mainly for you as our students and also for the audience out there. We are sharing with you a few tips here and there on how to ace it in your studies. We are pointing out the mistakes that healthcare students make and also how to avoid them. So karibuni sana to the discussion. Let's listen in. Let's bring our suggestions forward, and remember to share this widely. So the first question is, what are the characters of a confident student in clinical practice? Mr. Eli, tell us, what are the characters of a confident student in clinical practice? Karibu, you have 10 minutes.
Yes, thank you, Madam Daisy, for this. This is very important, and as the key healthcare training is very demanding, and the mistakes that students do today will affect how safe our patient will be tomorrow. So it's very, very important. When our students learn wrongly today, that means our patients are going to suffer when our students learn wrongly. So about the characteristics or features of a confident student, especially in clinical practice, number one, you find that a confident student is that one who is will always be honest. A confident student will always be honest in his or her dealing. For instance, we find that when a patient is there and you are having a patient who is sick and needs immediate care, And sometimes you find that you are unable to provide certain care, or you are unable to even do some, let me say, even diagnosis. Find that a confident student, what will a confident student do? Or even before receiving that kind of patient, that's what we always say, or we always called a consent form. This is where you explain to the patient what the treatment is all about, and the duration of that particular treatment, and how is that treatment going to be done, and even an alternative treatment. So you find that as a good and a confident learner, or a confident student, is one who is always ready and having all these tips. Why am I saying that? Honesty. Honesty comes in when explaining all this to the patient. You have to state everything, including even the risk and the benefit. So if you'll be providing this care, and there is a risk that is involved, you have to tell the patient that we are going to do this, but the kind of for instance, let's say pain that you are going to feel, or the kind of we are going to try on other medication. That is when it comes to alternative, you're going to explain to the patient that we are likely to do this treatment, but this is the alternative. This is the alternative treatment. If maybe you don't like this because this is likely to, as much as, sorry for that, as it will cause harm, but you're likely to reduce that harm. So this alternative treatment that you are likely to do what? To receive. If you don't want this cause harm, but as a medical student, we are likely to do what? We are likely, sorry for that, we are likely to work really hard and reduce that treatment. So being honest, you have to, you'll be telling the patient all sorts, or anything that will be doing to the patient, and everything that will be trying to do that maybe you are not, you have to assure the patient of each and every procedure, each and every steps, and even risk that is what, and even the kind of consequences that, as much as you are going to do. A good example in perioperative care technology, you find that some procedures are very complicated. You have to tell the patient that you're going to try this, and we are going to do this, but the likelihood of you getting healed is this and this, so that in case of anything, you are likely to do, the patient is likely to know that, yes, before the procedure or before the treatment, I was told that there's likelihood of this to occur. So that brings satisfaction. So honesty is one of the quality of a very good student. So Daisy, back to you. Daisy, are you able to? Daisy? And also, okay, let me proceed. Apart from honesty, that is being able to tell the patient everything that is involved in the treatment. Another one is also good service provider or provision. Good service provision. What am I saying? That a good student or a confident student will always be that student or individual that offers his or her services fully. What am I saying? If I'm a competent learner or a competent service provider, I'm able to do what is right. If it is a treatment, I'm able to do it correctly, and this is able to enhance safety, and even this will result to trust with the patient, because when you provide services in a correct manner and in the right manner, then the patient is able to get satisfied and the patient is able to trust you. So trust will be developed. Another characteristic or feature of a confident learner, that learner is always on time, especially in field practicums. When in matters of attachment, we found that, like I can remember when we were in our attachment, that is field practicum, some students used to come very late. Why? Simply because they feared practical part of their studies or practical part of their field practicum. You find that these students mostly they like reading more than doing what? More than practicing that which they are taught. So a confident student is one who will always arrive early, prepare what is needed, and even be ready to provide the service. And we find that this student who is able to arrive early will always, we find that everything is now, will always make everything to be in order. And that's bring me to characteristic or feature number 4. Will always be in order. Why? When you arrive early, you arrange your things, you prepare early, and being able to ready all that which is needed for the procedure, for the treatment to take place. That means even the kind of care that we'll be providing will be very orderly. So confident students are always orderly, honest, and apart from that, they are always good time managers. A confident student is one who also understands. A confident student is one who also understands. Why? What am I saying? You find that even in a classroom, we always have, let me say, 2 students. One who is a crammer and one who does what? One who masters and understands it, and even sinks it in properly. So find that some students, they like cramming, and especially when exams are nigh, and after the exams, they forget. So a confident student is one who understands everything, because they know that knowledge is needed. Knowledge is power in healthcare training, and knowledge is power, and even in healthcare as a whole, because healthcare is about life and what? Life and death. So a confident student knows very well that that knowledge has to stick forever in his or her head. Why? Because the life of the patient depends on that that kind of knowledge that is on the head. So that's another characteristic, that a confident student will always do what? Will always understand and master, so that even in future is able to provide care without compromising the health, or without risking the health of the patient. Another characteristic or feature of a confident student, we find that they're always good communicators. Good communicators. So, for in healthcare, communication is very, very important, because the kind of communication that you're supposed to give the patient is supposed to be very, very what? Very, very clear. And it's supposed to be, you're supposed to be kind even on how you communicate. And a confident student will always talk once. Will always talk once and not anyhowly. They know very well that there is due season for what? Due season for communication. Why? Because I think there's this thing that I always like saying, that we have 2 ears, 2 eyes, and 1 mouth. That means we have to hear twice, see twice, and even and talk, hear twice, see twice, and talk once. So that's what is needed of a confident, for a student to be confident. You have to be that person who communicates clearly and know when to communicate. And even as you communicate with the patient, you have to communicate kindly, and even the information has to be what? Has to be the information has to be clear, because this is what will make a patient to trust you. Another characteristic of a good student, just as Mr. Belden said, you find that most of them are always good time managers. They are always good time managers. So if I need to be confident in my, if I'm a student and there's that need of me to be a confident or to be a perfect service provider even in future, I have to manage my time right now. Why? I need to stop sleeping. I need to stop postponing what I'm supposed to do today. I need to avoid things that will take much of my time, because you find that especially in school, healthcare trainers, they like wasting time. They wait to read when exams are nigh. And we all know that when we waste a lot of time, work piles. So when whilst work piles up, and this you find that always for that kind of students that like wasting time, they usually have stress even during exams, and this always make them to do what? This always make them to fail in the exams and even to forget about certain important skills that is needed. So a confident student is that which is always that person is always what? Managing his time, and that means you find enough time to read even 1 to 2 hours a day. This confident student will always know how to manage his task. He can even choose to do one piece of task at a time in a day, so that rather than instead of waiting to do them to do everything once. So they're always good time manager. So even to the students, to students who are here, if you want to be a good student and a confident student, those are the most powerful characteristics that you're supposed to, or features that you're supposed to have. You have to, they usually, they're always honest, they're usually good time managers, they don't fear practicals, and they always do what? Even in work, practicum. So back to you, Madam Daisy.
Wow, thank
Back
you.
to you.
Thank you, Ellie. That was a long discussion on that topic of characteristics of successful students in healthcare. So we all know that Mr. Ellie is our surgical skills master, and we would like him to tell us about, the clinical skills that students are most nervous about. As a perioperative tutor, what is one clinical skill that when you taught the students they freaked out, or they thought twice about the course again, and why? Tell us why this practical skill or this clinical skill makes them nervous. Karibu, you have just a few minutes left.
So one of the skills that makes when I teach these students, they always seems to be nervous. Is especially, let me say, equipment handling, because a student cannot imagine holding or seeing a surgeon or a surgeon assistant holding what? Holding blade. Holding blade. Just imagine during that incision, seeing a surgeon making a cut or making a deep incision until, a good example is at that moment when we are doing CS. Just imagine reaching, even cutting the skin and even the other layers until you reach the uterus. So most of them, when I teach them, they find it really weird and even scary seeing incisions being made. Another one is specimen handling. Anytime I teach about specimen handling, my students tell like there's one that asked me that how can you carry someone's uterus? How can you carry someone's uterus that you are taking this uterus to the lab for investigations? How can you carry someone's let me say even fibroids? You are carrying a fibroid, and you know very well that this is something that has come out from a patient. and you are carrying this kind of specimen to the lab. So they can't imagine even carrying that's lots of blood, because many a times after the procedure, we take anything that we remove from the patient. We usually take them usually take them as samples and even forward them to the laboratory for various investigations. So they can't imagine carrying someone's placenta, and we are being told to maybe even dispose it or even take it somewhere. Imagine carrying someone's hand. Maybe there was that amputation that was done. You have to carry this hand, or you have to carry this leg that has been amputated, and you want to take it maybe to the lab, or even sometimes you have to liaise with the mortuary attendants to come and pick these amputated legs or hands. So they find it very scary and very weird. Back to you, Madam Daisy.
I had to turn off my camera at some point because my reactions were my reactions earlier on when you mentioned having to cut through a patient and now having to carry someone's hand, it's very scary even for me. So I understand why students can be nervous, and big up to healthcare students. They go through a lot, but through it all, they're able to succeed in their clinical rotations. So thank you for that. Thank you for that. I can see Mr. Lamek can relate. Asante sana for your reaction. We are moving on to the next part, still on neglecting clinical skills practice by Mr. Eli. Thank you for joining in, guys. On to the next part. Which one of these is the most effective way to improve your clinical skills? Is it watching a YouTube video? Is it practicing with a classmate? Is it reading about it in a book, or is it waiting until you are on attachment to learn it? Advise our students which is the most effective way to improve clinical skills. Is it watching it on YouTube video, practicing with a classmate, reading about it in a book, or waiting until you are on attachment to learn it? Karibu.
Yes, thank you for that question. It's very, very important. One thing I know about when you want to improve your skill, you have to train, you have to practice until you have to practice it every day until it becomes natural. Now, let me tell you something that I've learned, even in the healthcare, as a tutor. I've seen my students, there are some students that they like reading books and fear practicals. So just imagine, this is bad. Because why? Why is it bad? Because there's nowhere you'll treat a patient by quoting a book. You'll have, if in a surgery, you'll have to monitor vital signs. You have to handle the instruments. You have to even deals with handle patient, position the patient very well, and even ensure patient's safety. So there's no any single day a patient is going to be treated by quoting a book. You have to do what? You have to involve yourself and do something. So health is not all about theory. It's all about action. So that means if I want to improve, I have to practice and make it natural, not by watching videos on YouTube. Watching videos on YouTube is just an added advantage. But at the end of the day, you have to come out and practice. So practice is very, very important. And even, not only practice, even group work. Students who do much group work, they usually progress very well, because that is where they share so many ideas. And even apart from sharing so many ideas, they are able to learn from one another. So it's very, very important that practicing will always do what? Will always make someone to be competent and even be a skilled personnel. So it is always practice and practice until it becomes natural. Thank you.
Wow, well, that's a very good point you've given us, and on neglecting clinical skills for our students. We have pointed out the mistake, and now we are giving corrections and how to avoid them. So our students are encouraged to listen in and be able to get these tips from our tutors. That was Eli Otieno, our perioperative theatre technology tutor from Nairobi campus. So we are going to be moving on to the next part. Thank you, Eli. We're going to be moving on to the next part where Mr. Jones is going to be presenting. Mr. Jones, karibu to the discussion. You're the one who's going to be taking us through the last part, the fourth mistake, which is failing to network and collaborate. We know that mostly medical students maybe think that for them, the only thing they need to do to ace it in healthcare is going for clinical rotations or going for attachment, or maybe practicing this in school through their skills laboratory. But we forget that networking is also an important thing. And so tell us if this is the mistake that we do. So how do we avoid it? So you're taking us through the first part. How important is a student group? Is a study group in healthcare training? Because this is also a method of networking. The first question is, how important is a study group in healthcare training? Mr. Jones, karibu.
Thank you, Madam Daisy, for giving me this opportunity. So I'm going to discuss about the problems students make in healthcare practice, and I'll be looking at this problem, which is they fail to network and collaborate with others. So I begin by defining what networking is. Networking basically means building personal relationships with various people. This includes classmates, teachers, and other professionals in the medical field, including where students go for attachments, go for rotations. So building these networks is important as it provides support, mentorship, and other opportunities. Collaboration, on the other hand, is working as a team to achieve a common goal. So you work together. So be it studies, be it working on some projects. So it's important to be able to collaborate to solve various problems. So in my first question there, was working in a study group in a healthcare setting. Is it important or no? So working in a healthcare setting in a study group is very important, as it helps in retaining knowledge. So students are able to retain knowledge and participate in active learning. So students, when they fully participate in various discussions in study groups, so it solidifies their knowledge and helps them with long-term retention, so that they can use it in their assessments, in exams, in CATs, so they easily understand what has been taught. So another importance is that it clarifies complex topics. So there are some topics when tutors discuss in class. So some students get this information quickly. There are some students who get this information in a slow pace. So with this group study, so students are confident in sharing their perspectives regarding a particular topic. So the problem is brought down and a solution is gotten. So students are able to solve these complex topics that they do not understand during class time. Also, people are able to develop communication skills. So it's very important. So these communication skills are important in future when interacting with other students, other professionals, be it in attachment, be it in their job placements in future. So when studying in these study groups, people will gain these important skills that will assist them in future. So another importance is that it helps to build a professional network. So these students who you study together in study groups, they are important in future, as you can find them that they are becoming close colleagues with you at workplace. So when there's some opportunity, so they'll be able to network with you, and you build trust when discussing in these study groups. And lastly, it also helps support the mental well-being. So there are some problems in which students face, like frustrations in academics. So they remind each other and share their problems. So it becomes easy for those people who have problems regarding they have stress. So their psychological support is also addressed in this case. Thank you, Madam Daisy.
Okay, thank you, Mr. John, for that. You have taken us through that quite well. So we are moving on to the next part. We're going to be talking about still on the same issue. The fourth mistake on networking and collaborating with other students. So take us through this point. What's the biggest benefit of working with your classmates on a project or assignment? What is the biggest benefit of these students working with their classmates on a project or an assignment? The floor is yours.
Okay, thank you. Thank you again. So it's also important to work together, collaborate together while working in a project or assignment that you are given by the teacher or any other individual in your professional mentorship. So the biggest benefit is that students are able to get a deep understanding through various explanations. So students working together for a project, people organize their thoughts. So people give their ideas regarding a particular topic. So this leads to a lasting understanding of the material and than simply studying it alone. Also be able to develop various skills that we said previously, like communication, time management, and leadership. So these abilities are very effective, very essential in future and a success in your future career in healthcare. Also, working together in a project. So remember, you are solving a various problem. So your problem is solved amicably. So various students have various approaches to solve problems. So when you learn from each other, so you also become creative and you be fast in solving various issues that affect you in your studies. And lastly, it also helps reduce stress and increase motivation. So tackling a challenging assignment as a team. So the workload is reduced, so come up with solutions faster. Thank you, Madam Daisy.
Okay, thank you. Thank you for that, Mr. Jones. That is well noted. We have now discussed some of the mistakes that students in healthcare make when studying their healthcare course. So the last question for you, Mr. Jones, is it true or false that your professional network only becomes important after you have graduated? Is it true or false that your professional network only becomes important after you have graduated? Tell us if it's true or false and tell us why. Jones, over to you.
Okay. Yeah. So your network is very important before graduation because of various reasons. So building network with students, mentors, teachers, health professionals when working in something. So students are able to gain mentorship in various issues. So they get guidance. They get guidance in their area of specialization. So this helps them improve their academic abilities and their success in school, in getting various opportunities like internships. So when building these networks, so it becomes easy for you as a student to get early communication from your network that there is some opportunities in some area, and it becomes easy for you to get that particular opportunity that arise. Also, when you network as a student, you'll be recommended. You'll be recommended in various areas. So you get a recommendation that this student
Sorry, did we lose Jones? I can't get him. Hello? Okay, I think we lost Mr. Jones there, but we've heard what he has said about working and collaborating with other students, which is also a mistake that our students make. We fail to network, we fail to collaborate, we fail to attend the study groups. We only think life is all about clinicals and classrooms, but there's more beyond that. We can be attending science fair, the clinical fairs, medical expos, so that we get to learn what other students learn apart from us, so that we don't live in our small bubble. And now we're going to be moving on to the fifth mistake that students make. The fifth mistake that students make is usually assumptions on various things, especially in healthcare and also self-care. So we see that our students sometimes fail to take note of the patient's data, or maybe when you're taking vitals for a patient and you're forgotten to take down the exact thing that you have noted from that patient, you tend to forget, and now, or you tend to assume that maybe someone else took the vitals. Now this patient's life is in the student's hands. So we also make a mistake of failing or assuming in the healthcare sector, which is also a mistake that we are pointing out to our students. And therefore, to avoid it, we have been taught by Mr. Eli that we need to stay organized, especially for the perioperative students. They use a lot of instruments in the theater. So they have to be keen, they have to stay organized. You have to always have a pen and a notebook to note down this patient is feeling this way, so that you have that record in hand to avoid any further mistakes. And also to avoid assuming that a patient is okay and a patient maybe is not feeling well, maybe they fall while they're trying to walk themselves to the washroom, and yet you are there as a CNA to assist in that. So we have to put all this into the keen consideration. So thank you so much, our speakers of the day on the topic of Tutor Spotlight Wednesday. Thank you so much on the topic of mistakes students make in healthcare. That was a wonderful discussion. We've learned a lot. We've gotten nuggets of wisdom. We've gotten tips and tricks on how to ace it in healthcare. So I would like to pass on the mic to anyone who has a question. Anyone who has a question for the other, anyone who has a question. We are leaving this on our social media platforms for our students to refer and also for our audience to refer to it. I know we are all tutors here, but we are leaving it on our social media platforms to leave it to our students to refer, because these are very important tips that we have shared here. Mr. Caleb, do you have any question for the healthcare tutors? Mr. Caleb? There's HP, there's someone with HP initials. Let us know if you have any questions. Okay. Mr. Beldens, do you have any questions for our speakers, our healthcare speakers?
Not really. I'm good. I only encourage our tutors and our speakers to keep doing more research in making our academics better. The more you learn also as a tutor, the better your delivery and the better the quality of services that you give.
Okay. Thank you all for that. I think up to there, that's all that we had for today. So since we don't have any further questions, Mr. Jones is back. Mr. Jones, let us know if you have any further questions in regards to the topic of discussion today, or any last tip that you want to add to our students. Let us know if you have anything so that we can move on to the next part. We are at 18 p.m. We are closing in a few. Let us know if you have any questions or any additions. Yeah. Your network cut you off, but you're back. Thank you, Mr. Jones.
Addition.
Yes, Karibu. Okay. I think up to there. Yes.
I have an addition. Okay.
Okay, I'll let Mr. Jones speak, and then Mr. Eli will speak afterwards. Karibu sana, Mr. Patrick. Karibu sana, Mr. Patrick. You're late to the party, but I hope you've brought your cup of tea with you.
Okay, I'd covered most of the areas, so it's very important as a student to network and collaborate before graduation in order to access various opportunities. Also engage in emotional support, building reputation, and also you referrals in future when any opportunity arise. Thank you, Madam Daisy.
Thank you, Mr. Jones, for that. I thought I saw Patrick in the meeting. Seems like
thank you, Madam Daisy.
Okay, thank you. So we have had a wonderful discussion. We were talking about the top 5 mistakes that students make in healthcare courses. This is the Tutor Spotlight Wednesday, and I hope we've learned a lot. Personally, I've learned a lot on staying organized as a healthcare student, on time management, and also on various strategies that I can use in my studies. What have you learned? I hope you've carried a tip home, and I hope this was a fruitful discussion for you as well. So we are going to be moving on to the next part. Apart from the question and answer session, we're going to be moving on to the next part.
Tracy, I had an addition.
Oh yes, Mr. Eli. Sorry about that.
Yes, there's this. Yes, this is one of the biggest mistakes that I feel, or I felt like we should talk about it, or I should talk about it. Like the one for. Sorry, let me put my camera. Let me put my camera on. Let me put my camera on. Yes. There's this one that I felt that I should talk about. Not a mistake that one of the mistakes that students like doing is not working as a team. Not working as a team. We find that even in healthcare or anywhere, teamwork is very, very important. We have some students who are very selfish. They don't want to share and even to help each other. Maybe they feel if you help me, maybe you are going to defeat me. So they feel like they should keep that knowledge to themselves. And even, in surgery, for us in theater, you cannot do surgery alone. You need the surgeon, you need the anesthetist, you need a nurse, and then you even need the scrub nurses. So teamwork is very, very important. So how can we solve this? Or how can our students solve this? One, they need to practice what teamwork, and they need to help one another, because this one, you'd rather move. It's good to move with. You cannot move alone, and you need each other. So even in healthcare, we need each other for even procedures to be successful. And again, there's this that overconfidence. That is another mistake that healthcare trainers they usually have or like doing, being overconfident or pride. They feel like they know everything, and now there's no need for learning. And and some even because of this, some even tend to correct teachers in a wrong manner because they feel they know everything. But that's not the case even in the health care, because overconfidence has led to so many students, or even the qualified nurses and even qualified surgeons, giving wrong medications because they feel like they know everything. So that is one of the things that we should, as healthcare trainers, we should know that we're not supposed to have that pride. And now what can we do to avoid this pride? Let us always be ready to learn, because learning is a continuous process. So let us not be a kind of a person that pretends that he or she knows everything, but at the end of the day, you may not know everything, because learning is always continuous. So overconfidence and and teamwork. So thank you, and back to you.
Asante sana, Mr. Eli, for that. You have added us more points. And so we have also learned about helping one another because it's all about teamwork for us to be able to succeed. So the fear of being defeated is actually the 8-4-4 system mentality that we used to have, but we are learning new ways nowadays. So I hope with our students, they will also be able to help each other and work as a team, especially in the theater. So I have so many questions in my head about the perioperative course and also the CNA for our tutors, but we see that we only have 5 minutes to time, so I will only ask one question. In the theater, we usually have so many equipments to be used, and we usually see our surgeons having their hands up and asking the perioperatives to give them an equipment. Do they usually speak? Because according to the videos that I've watched online, we only see them indicating with a hand, trying to indicate with a hand. How does this perioperative know whatever instrument or whatever equipment the surgeon needs?
Yes, Madam Daisy. You find that in surgery or even in any operation room during any procedure, one of the key roles of theater technologists, in fact, during surgery, we forget even about that name. We become the scrub nurses. So, as a scrub nurse, one of my roles that I'm supposed to know before even entering that room is I have to anticipate the needs of the surgeon. That means, in theater, about anticipating the needs of the surgeon. Anticipating the needs of the surgeon means, you know what is next. If you've draped the patient, and you've made the patient sterile, and then everything is ready. You know very well that what next is you're supposed to carry the blade. The surgeon is not supposed to ask you that blade for that blade. You're supposed to have it on your hand and put it in such a manner that surgeon is able to do what? To access it. So after carrying the blade, you know that what next? I have to have an hemostat, or I have to have a gauze. That means the gauze will help the surgeon. You know very well in your mind that the gauze will help the surgeon to do what? To make the site visible, especially during bleeding, for wiping blood. And why do I need to have an hemostat? That as the surgeon is making the incision or cut, I have to have that gauze, or a big gauze, call it abdominal gauze, to compress that particular point that is bleeding. So it is always our role to know that, and to anticipate the needs of the surgeon. You're supposed to know what is next. After the incision, after the achieving hemostasis, you have to know that what is next. I have to have, let me put my camera on. I have to have a retractor. Why do I need to have my retractor? Because I know very well that after the incision, the surgeon has to see what is happening, what is in there. And he cannot see what is in there, or the organ that is in there, or even the tissue that is in there, without retracting and exposing the inner part. So I'll have to carry my retractor. Again, the reason why we always raise our hand, or we always be in a prayer mode in surgery, a prayer mode is always, we always say that anything that is below my waist is sterile. Anything that is above, let me say from my shoulder to my head, is also unsterile. Unsterile simply means with germs, but sterile simply means free from contaminants or microbes. So below my waist is contaminated. From my shoulder to my head is also contaminated. My back is also contaminated. So in between, that is from my waist to my shoulder, that is front only, is what is sterile. So that's why my hand is always, or our hands are always up or in a prayer mode position, because if you put them down, you are rendered as unsterile and you'll be chased out of the theater. If you put them on your head, you'll be chased out of theater because you are unsterile. Because in theater, we are supposed to follow what is called aseptic techniques. These are practices that help us achieve safe surgeries. That because theater, when we do operations, we have to, everything that we use has to be what? Has to be free from contaminants, has to be sterile, so that at the end of the surgery, or even after the surgery, our patient doesn't get infection or post-surgery infection. So that's why our hands are always up, because we are trying to maintain sterility. Just as I said, our head, from our shoulder to our head is unsterile. Our back also is unsterile. From our waist to our leg is also unsterile. So we're allowed even to hold our hands, to put our hands in the stomach, or even remain in the prayer mode position. But above all, we always anticipate the needs of the surgeon. Thank you.
Thank you. Thank you so much. Thank you so much, Ellie, for that. At least now I know why you are always in a prayer mode. And also you anticipate the needs of the surgeon. So that that reminds me that you have to be keen while in surgery, because now you have to be thinking ahead of the surgeon. What could he be needing next? So thank you so much for that. We have had a wonderful discussion. I've learned a lot. I hope you've carried a few tips home as well. So we are coming to the end of this session, the Tutor Spotlight Wednesday. We are coming to the end of the session. So thank you all so much for making time for this. We hope to see you again next time. Asanteni sana our speakers, Mr. Caleb Bonyari, our tech guru. Asante sana for choosing to be with us this evening. Thank you so much, our registrar, Mr. Belden Soko, for choosing to be with us this evening. Thank you, Mr. Eli, our collaborative tutor, Nairobi campus. And thank you also, Mr. Jones, for joining in the discussion and for making time for this. Mr. Lamek has also been with us. There's also another person with the initials HP who has been with us. Asante sana for joining. So in case anyone doesn't have anything else to say, I can see we are past 8:30. So we would like to close with a word of prayer. We are closing with a word of prayer from Mr. Lamek. Karibu, Mr. Lamek. Mr. Lamek, close the session for us with a word of prayer. Okay, all right. So let us close the meeting with a word of prayer. It seems like Mr. Lamek won't be able to do it. So, dear Heavenly Father, thank you for this discussion. We are grateful for the evening. We pray that you may bless each and every one of us who was able to attend, and even our audience, that they shall understand. We are grateful for yet another day, and we bless we bless all these meetings. We hope that next time, Father, we shall be able to make a lot of impact to our students. In Jesus' name I pray. Amen. Thank you all and have a good night.